Fine. So passive voice sentences and how to write recommendation part to make complex sentences. Fine. Welcome to Grand Master Class, a part of Seven Sentinels. This is the classical corrections for writing sessions. I am Peter Simon with you. Today we are dealing with the writing essentials. We have done with the part 1. And now we are going to the ingredients. Every grain. Cooking each and every grain. One by one. Every grain should be properly cooked. So here the sentence, each and every sentence is very, very important for us. Yes. Maximizing quality minimizing quantity. So quality means the style, the presentation. Quantity means the number of words. So double-edged sword. Quality should increase and quantity should decrease. The more the water in the buttermilk, the less the less tastier it is. The more the water in the buttermilk, the less the taste it gives you. You cannot enjoy. So less the water in the buttermilk, more the taste. So that is how it is. This letter is yogurt. Yogurt means curd, thick curd. Thick curd, when you reverse also, it will never fall down. Mind you, thick curd, flawless curd, without a drop of water. Yes, I have seen a number of times. So you would have to check the quality of milk. Don't use it. Don't adulterate it. Take the milk as it is. Heat it. Don't heat too long. Heat it properly. Then put some curd, small, okay, with a spoon, small slice of curd. Put it in the milk. And next day morning, take the bowl and put it upside down. Without the lid, I mean. Remove the lid and put it upside down. Curd will not fall down. It gets stuck there. That is curd. That is quality. Now, without adding any water, that quality curd, without adding any water, just churn it well. And then give some sugar, add some sugar. Tastes wonderful. Oh, wonderful, without removing anything. Okay. So your letter B. So should your letter be. Same manner. There should not be any problem. Without anything, still it should stand like that. That is quality letter. It has two components. One is maximizing quality. Okay, purity of milk. Minimizing quantity, water. Remove. Now, it will be perfect. So your letter should be like that. Add quality to it. Remove unnecessary words, irrelevant words, repeated words, unnecessary words, words which are there but has no benefit to you because they are already understood. Lot of things are there. Just listen. Okay, just listen. Right? So use them. If you have any doubts, don't ask me why, what, and all, because I'm not the right person to give you answers, because my knowledge is limited. Go to Cambridge University dictionary or go to OET official website and ask. They will tell you. That would be better. Then next. Maximizing quality, minimizing quantity. Right. I'm going to give you some sentences. You are supposed to write the sentences. Yes, I'll give you one sentence. Based on that one, you have to write some other sentences. Different styles you can write, change the word, do whatever you want. How many examples you want to write, you write, no problem. Okay, but think and write, just don't throw your words. Think and write. Think before you ink. Look before you leap. Afterwards, there is no meaning in worrying or getting upset. Official OET. Yeah. Search OET official sample. Yes. Yes, official sample and writing. Okay. I'll take from here. Pens ready? Write in your notebook first. Then afterwards you can type in the chat box. First write in the notebook, because there you will know, you can erase and do everything. Once you feel that it is correct, then you can type in the chat box. Right. So sentence by sentence we'll learn how to write when it is replacement, how to write when there are signs and symptoms, how to write when they have presented, how to write when somebody admitted, how to write when they are being discharged, all these things. Samples I'll give you. If you learn this thing, any letter will be easy for you. Any letter. This is my solution to you. Mark my words. Materials. OET nurses and doctors. Okay. Let us take nurses, because nurses are more. So test number 1, test number 2, test number 3, test number 4, test number 5. Fine. 1, 2, 3, 4, 5. Okay. This is test number 1, 2, 3. So this is 3, 4, 5. This is 4, 3, 4. Okay, fine. Test number 1. Yes, challenge for you. Who will win, you or I? We are going to have a marathon race, because subject is like that. Subject is like that. It's a marathon race. You're going to run for a long period. So what I'm going to ask you is, if today's lesson you have, if you attend this session now, which I'm going to give you, you will never have a problem in the future. There may be some small difficulties, but not serious problems, because every type of things we are going to answer, understand. And once again, I remind everyone, no negative comments, no comparison with others. If you feel this is good for you, stay there. If it is not good for you, better quit. No worries, but no negative comments, no writing in the chat box without my permission. Only when I tell you to write, you have to write. That's all. Okay? And anything positive, is there positive? Negative people should remove their negativity and be positive to go forward. Fine. Now, others, everyone, type your name. I want everyone to type your name. I don't want phone numbers, iPhone, Samsung, and V2070. I don't want these things. I want the name of the candidates. If you want to give the name, fine. If you don't want to give the name, Abhi Magesh. Okay, right, fine. All of you, write your names and remain here. Otherwise, exit and come back with your name. Anything is okay. Type your name, I'll change your name. Fine. So, this is one case notes. This is one case notes. So this is left total hip replacement. So file, save as. Okay. Now, left total hip replacement. Reason for admission. You can write in 100 different ways. Left total hip replacement. Left total hip replacement. Remember that. So this is very, very important. This is better. So left total hip replacement. He was admitted for left total hip replacement. That's it. And after that, he was discharged on 7th. Discharge date. So you can understand this is a discharge letter. So you'll have discharge plan. So remember this. So where to where I am taking, you see here. So this is admission for a purpose. Left total hip replacement. So that is the point here. Now you have to write a sentence with this. Left total hip replacement. And here in the case notes, they are capital letters. But in the middle of the sentence, you need not write capital letters. This is case notes, so capital letters are there. There you need not write capital letters unless and until it is necessary. Because this is a common name, so no need capital letter. So what I want you to do is write one sentence. Yeah, Ginny, very good. So write your, thank you very much. So write one sentence using this one. Left total hip replacement. This is what, when somebody says do this, okay, I asked for the name, she gave. Very good. I appreciate people like this. So write one sentence. Write one sentence. Who is this iPhone? I'm giving you 3 calls. Please either type your name or unmute and tell your name. 3 calls. Afterwards, it will be removed. The candidate will be put in the waiting room. I want the names, please. Right. iPhone, I won't need the name. Okay, fine. Write down in your notebook. Write down in your notebook one sentence, and afterwards okay, write down one sentence using the word left total hip replacement. This, use one sentence. Left total hip replacement. Use one sentence. Make one small sentence. No problem. No need to write big sentence. Small sentence you can write. Write down in your notebook first. Okay. Yes, very good. The strength is increasing gradually. By the time it's evening, everyone will come. So now, how you are going to write this sentence? Now here, two things are there. Number one is Mr. Gerald Baker. Mr. Gerald Baker. This is one point. Then next one is left total hip replacement. Left total hip replacement. Okay. This is the thing. Mr. Gerald Baker and left total hip replacement. So here, these are the points which you are taking. So how can you, okay, write these sentences? How can you write these sentences? You can write these sentences in different styles, 101 styles. Mr. Gerald Baker underwent a left total hip replacement. Mr. Gerald Baker has undergone a left total hip replacement. Mr. Gerald Baker underwent left total hip replacement surgery. Mr. Gerald Baker has undergone left total hip replacement surgery. A left total hip replacement was performed. Passive voice. Previous ones are active voice. This is this passive voice. left total hip replacement surgery was performed. A left total hip replacement has been performed. Left total hip replacement surgery has been performed. Now here, why so many different variations of sentences are there? Now let me tell you one thing. Surgery, many sentences, okay. I'll give you a lot of examples. So try to learn the different things for different situations. You have to dance according to the rain. That's it. So fine. Now coming to the point, if you are saying Mr. Gerald Baker has undergone, that means has plus V3. That means you are using present perfect tense. That means you want to talk about it as present tense. Then you are not supposed to talk about date. You are not supposed to talk about yesterday. Then you can say has undergone. That means you are talking in the present tense. That means recently. It may be today or yesterday or day before yesterday. But don't say day before yesterday or yesterday or on 24th. Now today is 23rd. On 22nd he was admitted. Don't tell the date. Then you can use present perfect tense. No problem. No problem at all. Because timing is important. That is what is tense. If you know what is tense, then it will be easy. If today you are telling, that means you are dividing time into 3 different groups based on day. Today, 23rd is today, 22nd is past, 24th is future. So this day, this unit of measure is day. Then today will be present, yesterday will be past, tomorrow will be future. That's it. So time is not any specific. Time is measurement specific. What unit you are using, based on that one time comes. This century means 100 years. This century is excellent. This means this 100-year period is excellent. That means this. So century is the unit. This century, that means 21st century is present. 20th century is past. 22nd century is future. So that means present tense, past tense and future tense depends on the unit you are taking. So play wisely with the unit of time. Unless and until you take the time appropriately. When you tell yesterday, the word yesterday, then it is past tense. Never use present perfect with that. Yesterday I have gone is nonsense. Nonsense means nonsense. Today I went is nonsense. Today means present tense. You cannot say went. How can you say went? Then you say today at 10 o'clock in the morning I went. It's okay. 10 o'clock. That means you're talking about o'clock. Now it is what time? 6 o'clock. So o'clock is important here. O'clock is demarcating. 6 o'clock is present. So morning 10 o'clock is past tense. Night 10 o'clock is future tense. That's very clear. So if you want to talk about tense differentiation, try to understand what is the unit of time. Many people cannot take this one. I don't mind. I don't mind. Now, I'm going to ask you one question. So I'm removing somebody because they don't have name. So, next one. Don't come without a name, please. Nobody is nameless in the world. So next. Yeah. Time and tense. We are going deeper into the concept of tense. And because tense, you don't know, a lot of people don't know what is tense. I'm asking you the question, interested. If you are saying yes, write Y. If you are saying no, write N. Majority wins. If many people say N, then we are not going into this topic. If majority people say Y, we are going into this topic. Because I am going to blast my head. You are simply sitting there. Okay, if you say yes, I'll go. If you say no, I'll stop. For me, no worries. Either ways, I'm happy. I'm going deeper into the topic. Deeper into the topic. Because without learning tense, you cannot write sentence. Without learning tense, you can never, ever write a sentence 100% accurately. So tense is very important. Something you will write, you think that it is right, but it is never right, and you will not even understand that it is wrong. Because nobody told you. Sir, nobody told us, sir. Nobody told us, sir. That's it. So, right. And that's all. Next, we are moving forward. So now what is this tense? Tense is related. Tense is related to the time. Time. Time is the unit of measurement. Based on this unit only, you can say, for example, 1 kg, less or more. You have an iron weight, a stone of iron measuring 1 kg, and based on that standard, only you can say that it is either less or more or correct. Standard will give you less or equal or more. So it is trifurcated. 3 ways. It must be exact 1 kg. So you are measuring this, the balance on one plate, you will put 1 kg weight stone, and in the other plate, you will put 1 kg rice. We are measuring rice. So rice, stone cannot be measured on rice. On the way. So stone is the standard. Now, based on this standard, you will remove or add rice until it stays exactly 1.000 or 1000 grams or 1 kg. So until that is correct, you'll measure those things. So this is the standard 1 kg. 999 grams is less. 1001 grams is more. That's it. So you are differentiating this rice as less or accurate or more depending on the 1 kg weight. So what is the weight that you are using is important. So tense is trifurcated based on the unit of measurement. Now, what is this unit of measurement? It may be this minute I am teaching. That's it. The previous minute is past. The next minute will be future. Minute. This moment, I'm silent. That means one moment before I was talking, one moment later I will be talking. This moment, silent. So it is based on moment. This year, I am in Kerala. That means last year, I was not in Kerala. Next year, I may not be in Kerala. So that is weird. So this year, last year, next year, last and before, all the years before, past. All the years after, future. Right. So, mind you, I am in Trivandrum in September. I am in Trivandrum. That means last month, past, next month, future. August, past, October, future. This week, I'm focusing on exam going students. That means this week, till Saturday, Sunday to Saturday. This week, I'm focusing on exam going students. That means last week, I was not focusing on them. Next week, I will not focus on them. That's it. So here time we are based on. So now, if your time falls within this unit which you are measuring, this unit, then it is present tense. The previous unit, that is previous, that is past. The following, that is future. Write down. The previous, past. Last, past. Before, past. Ago, past. These are the clues. Write down. Last, ago, previous, before, prior, earlier. So these words are there. It is past. Now, this, current, present, at the moment, look, see, watch, observe. This is present. Next, after, following, future, in the coming days, following, later. These words, 1 week later, later, future tense. So I hope you understand. This week, I have visited Trivandrum. Correct. Monday, I visited Trivandrum. Monday is gone. I am dividing based on days. Day, Monday, 4 days back. Thursday, today. Today, Monday is 4 days back. Days. Okay. So try to understand how you are demarcating these sentences. You can use present tense, you can use past tense. But remember what word you are doing. If you do not use the word, everything is correct. If you say yesterday, last week, previous month, a year ago, earlier century, previous decade, all these words, if any one word is there, you should say past tense. We too. I visited. That's all. Past tense only. But if you say this month, this year, current hour, present generation, at the moment. So like these words you use, you have to use present tense. I have visited Delhi this month. That's it. But if you say last week will fall in this month. So this month is present tense. But if you say last week is, even though it falls in this month, it is last week, not this. So past. Last week, I visited Delhi. Now, what is this past and what is this present confusion? Sir, we don't want this confusion. Then you can say, I have visited Delhi or I visited Delhi. Both are correct because you know what you are understanding, what you are talking. That's very clear. The problem is there, if you don't put these things, there is no problem. Yesterday, today, time factors, if you don't put, everything is fine. But once you put the time, be careful, you are in danger. Yesterday I have gone is wrong. Today I went is also wrong. That's it. With today, if you say today at 10 o'clock in the morning, I went, correct. But today I have gone. But when you say time 10 o'clock, so now it is 6 o'clock, 10 o'clock is past. That's all. So you have something called time factor. If time is there, or a day is there, or year is there, or month is there, or related words to timings are there, be careful with tense. Otherwise, your skin is saved. That's it. Time, very important. Because both are correct. Fine. Now you understand what. So that is the reason why I told you here. I told you already here that it depends on you. How you divide time. Based on that one, you make your sentence. So here I told you, Mr. Gerald Baker has undergone a left total hip replacement. Finished. Why I am telling has undergone? That means I am talking recently. So this week only. Yesterday only, but I am not bothered about yesterday. I am just saying nothing. So it is correct. If you say on 22nd, then you have to say it is wrong. Because you are talking based on day. 22nd is yesterday, 23rd is today. You are dividing based on day. So today is present, yesterday is past. So when you say yesterday or 22nd, the previous day, whatever you say, it is simple past tense. On 22nd September 2021, comma, Mr. Gerald Baker underwent a left total hip replacement or whatever replacement. So I hope you understand. If you don't write yesterday, then present tense is also correct. Fine. So mind you, be careful. Be careful. It's not necessary that every time you have to write the dates. Okay. It is understood sometimes. So no need to repeat the dates. Fine. Now surgery. Whenever you are using the word surgery, don't use a. So whenever, be careful, be careful. What I was telling. Tense. Tense. So here, yesterday or on 22nd September 2021. Yeah, I was telling about surgery. Right, I remember now. So surgery. Now what is this surgery? Surgery is uncountable now. You cannot say one surgery, two surgeries, three surgeries. There is nothing called surgeries. Surgery. That's it. Like furniture. So now what you are supposed to do is, don't use a or an with this thing. So a surgery is wrong. Just leave without a. In the same way, when you use replacement only without surgery, then you have to say a replacement. So one replacement may be there, two replacements may be there, three replacements may be there, number of replacements may be there. Remove one and put another, remove one and put another. There may be 1, 2, 3, 4 replacements. So that's not a problem. So it is countable. So there you have to say So whenever there is something called replacement, hip replacement or shoulder replacement or knee replacement or whatever it is, elbow replacement, whatever it is, when replacement is there, put article a or an according to requirement. If after replacement surgery also is there, or without replacement surgery, if the word surgery is there, no article. If the word surgery is there, no need of a or an. But if surgery is not there and only replacement is there, you must write a or an. Write down the rules, whatever you want to write, because these are very important rules. You cannot ignore these things. They must have types of knowledge. So I have explained many different points to you now. Now I just want to move forward. So you understood, I think, what is surgery and what is replacement. Surgery is uncountable, replacement is countable. So with countable nouns, mouse, mobile phone, table, book, okay, pen, all these things, countable. So you, for whichever things you can say s or es, then you can use a or an if it is singular. Otherwise, you need not write. Uncountable, which you cannot count, like water, a water, 2 waters, 3 water, no. Right? Be careful. Then next one, which are uncountable, never use article a water, wrong. So you cannot count surgery, a surgery, 2 surgeries, 3 surgeries. There is nothing called. Go to the Cambridge Dictionary, find it out. So it is uncountable and medical and formal word. So next, so I have clarified the concepts of simple present versus present, sorry, not simple present, present perfect versus simple past. Clarified. This is first concept. What is the difference between simple past and present perfect? How many of you understood? They type yes, Y, and no, type N. because we are going to the next questions. Concepts have to be cleared. Otherwise, moving forward is a waste of time. So if you have understood the difference between when to use simple past and when to use, no, both times you can use both things. That's it. If you want to use simple past in present tense, broaden the time. November I visited, sorry, April I visited Delhi. That is simple past. This year I have visited Delhi. That is present tense, simple, present perfect. Both are right. Both are right. So what type of unit of time you are using, that defines your tense. That defines your tense. Fine. Next, second point is countable versus uncountable. So this is whether to use article or not. Article or no article. Article or no article. Understood? Then type Y. Not understood? Then type N. So we're moving to the next part. Moving to the next part. Now, I want you to write one sentence using simple past tense. Right? On 22nd or on 21st or whatever it is, put the previous date or previous month. In July 2016, he visited. Month or year or date or decade or century. Anything in the past, dated in the past, and write one simple past tense. All of you. All of you. Nidhi Aurora. Start with a capital letter. Rest of them with small letters. Ending with a full stop. Even by mistake, do not be away from these rules, because that is meant for your own good. Okay, we are learning, no problem. I can correct you. I know that you don't mind. So full stop is no need to feel sorry. Why? What wrong you have done? No need. Why sorry? Children make mistakes. Wantedly mistakes? No. They don't know, so they make mistakes. That's okay. Or they don't know the seriousness of the topic. That's why they make mistakes. It's okay. So, fine. Punita, you have to put a full stop. I booked a flight. Priya Thomas, wow. Very good. I watched TV last Monday. Why do you want to write TV in shortcut? You can write television, a big word, no? So as far as possible, avoid shortcuts in letters. Don't say IV, write intravenous. Don't say main, write morning. Don't say nocti, write night. Okay, BD, twice daily. Don't write BD. That's it, that's it, that's it. So whenever you do something, I'll explain like this. I'll explain like this. Okay. Come on. Ashley, you have to write as capital letter and full stop in the end. I attended a farewell party yesterday. After yesterday, full stop. Who will write full stop? And she sang well, full stop. I saw a movie yesterday, full stop. Manikanta. Yeah, come on. Write down sentences. Write down some sentences. I want not ordinary sentences. I want the sentences which you will write in the OET letter. Think about them. Who want these sentences? I don't want these sentences. Subject related sentences. We are into medicine letter. These are fifth class sentences. Even a fifth class boy will write. I want medical related sentences. What are we learning? Fifth class language or OET of Reshma Rauchu? Mr. Ergar was visited Kerala. Not was visited. Visited Kerala. Was is used to refer passive voice. Okay, Kerala was visited by. That is passive voice. Not was visited. Okay, and whenever you are writing month, write in the word form without slashes. Many mad people, what they do, they tell write like anyone, no problem, but they don't know that internationally there are many different variants of writing the date. It is 10th of August or 8th of December, October, who knows? Because in countries, month will be written forward. You don't know, so better write in full. And Ashley, J capital letter Ashley, in July 2020, Mr. David, after comma, you have to leave space. Mr. David underwent hip replacement surgery, full stop. Who will put full stop? One time told, always followed. That's all. That is the rule. You know, listen from here, leave it from here should not be the name of the game. Dr. Bushra, welcome. Okay. Yes. New candidates, let me greet. Hello, Dr. Bushra.
Yes, sir.
Hello,
Hello.
Dr. Bushra. Where are you from? The Middle East?
Sorry.
Are you from the Middle East?
I'm from Pakistan.
You are from Pakistan. Okay. Okay, fine. Welcome to this session. Is this the first time you are attending my session?
Yeah, writing part first time.
Okay,
I
that means you
attended
are.
your discussion. Yes.
Okay, fine, fine. Earlier also you attended other sessions. Okay, fine. Right.
Yes.
How do you find our sessions?
Yeah, sir. It's always room for improvement by attending your lectures, and it's always a learning. But sorry, I didn't keep you in touch continuously because of duties and. But I'll try to now. I'll try to.
No problem,
follow.
no problem. No man can serve two masters. No
Yeah,
man can
sure.
serve two masters. That's it. So when you are doing two things, you cannot make anything happy. So that is the problem. It's okay, but try to do something. Okay, you cannot
Yes.
do justice to two things, right?
Yes, sir. Thank you. Yes.
Oh, no problem.
Thank
No
you. Allow
problem.
me to attend the class. Thank you so much.
No problem. No problem. Yeah. Next one. Rajput. Rajput. Hello, Rajput. Hello, Ashley.
Hello,
Yeah, Rajput,
sir.
you can speak. Yeah, tell me, Rajput, where are you from? Are you from the Middle East? Sorry, are you from Punjab or Madhya Pradesh?
I'm from Rajasthan, sir.
Rajasthan. Okay, okay, Rajasthan. Fine, fine, fine.
Yeah.
Okay, what is your name?
Vish Rajput.
Okay, fine. Right. How are your sessions? How do you feel regarding the sessions? I think you have attended 2 or 3 sessions earlier, right?
Yes, sir. It's really nice, and it's so meaningful actually, and I got too much improvement in my practice.
Very
and
good. Excellent.
it seems like if we will continue a session, then I'll reach to my goal.
Yes. Okay. Thank you very much. And any new candidate? Yeah, Bhavna Sharma. Bhavna Sharma from Haryana or Punjab.
Hello.
Hello, Bhavna. Are you from Punjab or Haryana?
No, I'm from New Delhi, sir.
You are from New Delhi.
New Delhi.
Okay,
Yes, sir.
Bhavna. What is your profession?
I'm a staff nurse, sir, nursing officer.
Okay. Okay, fine. Very good. That's wonderful. You are serving the humanity in the time of crisis. Okay.
Thank you.
Right. How do you feel our sessions? Is this the first time you are attending my session, or have you earlier attended any of my lectures?
This is the first time that I attend your class.
So how do you feel? Are they useful to you, or is it unnecessary, or what do you feel regarding the sessions? No problem. Speak frankly.
I think, sir, it will be very helpful for me, and I think it seems very necessary.
Okay, fine. Ashley, I called you, but I forgot you. Okay, age is a problem. Yeah, Ashley, you can speak.
Yes, sir.
Yeah, how do you feel the sessions, Ashley?
It is the first time I'm attending the class, this one section, and it is good.
Okay,
It-
right. Okay, fine. Now what you're going to do is, now active voice you have written. Very good. Now I'm going to see your sentences. Yeah. Yes. Now number of students have written. Right from, yeah, Ashley. Okay. Well, Mr. Jim underwent. Then Robert presented. Mr. Brith had a fall at her home yesterday. Right. Mr. Baker was admitted. Now, what I want you to do is write the past tense in the passive form, removing the doer, and make the action important. Yes. Make the action important. Passive voice sentences. Write down passive voice sentences. Yes. Make the passive voice sentences. Passive voice sentences. So I'll give you the words and you will go, I'll give you one sentence and you'll make the other sentences. I'll give you one sentence and you'll make other sentences. Similar sentences. Change the name, change the verb. Okay. Right. I'm going to give you the sentences. Mr. Baker is being discharged from City Hospital back into your care today. This is sentence number 1. I want you to write similar sentences. Change the name. Mr. Booker is being transferred instead of from to your facility, your care, from City Hospital today. Change the position, change that one here, change it. Right, finished. Do whatever you want. Change the style, change the position, change the words, change the names, change everything. But don't change the tense. Change the tense, don't change the tense. You are learning tense here. Mr. Simon is being punished for teaching a long time to the online students today. Do whatever you want. Write down in the chat box. Whatever you want to write, you can write down. Sentence number 1. OET nursing. OET nursing. And this is Mr. Gerald Baker. Yes, OET nursing, Mr. Gerald Baker. So we are going to take this one as a study. We are going to take this one as a case study. Fine. So write one sentence. Yes. All right. Now here, the sentence, same thing, but change the style, change the word, change the name of the patient, change the name of the hospital. Instead of city hospital, write town hospital or municipal hospital or private hospital or public hospital or Johnson's hospital or children's hospital. Change anything you want. Try to play with it. Use your mind very sharply. So you are going to learn. Yes. I'm coming with the second one now. I'm just giving you time so that so this is Mr. Gerald Baker, OET nursing. Now next one is number 2. Yeah. Sentence structure 001. Sentence structure 001. Yes, that is the sentence structure 001. Fine. Now this sentence structure you have to write. This is the sentence structure you are supposed to write. Come on, write down. Finished. 14 students have written. Mr. Baker has been discharged from your facility. Mr. Baker has been discharged from your facility. Mr. Baker requires continuing care after being discharged today. Mr. Muhammad was in our care for complete heart block treatment. No, complete heart block. Confusion, Punita. Miss Bell is being referred to the dietitian for her nutritional, or to a dietitian or to the dietitian. Without that, it is not fine. For her for her why? Miss Bell for her only, not for somebody else's. So why do you want to write her? No need. Is understood. She is being referred for her nutritional assessment only, not for mine or not for your nutritional assessment. She will be treated for her only. So even without telling that one, that is irrelevant here. That is redundant, meaningless. No need. It's understood. Fine. Next one. So this is first sentence. Next sentence. Yeah. Sentence structure 2. Okay. He underwent a left total hip replacement. Come on, write down. He underwent. This is correct. He has undergone also is correct. But before, if you tell yesterday, then everywhere it will be changing to past tense. If you don't tell time, anything is okay. He underwent a left total hip replacement. That means in your mind, this is, you are thinking that it is yesterday. So that's why you wrote underwent. Otherwise, in your mind, if you think this week or recently, then you will say has undergone. That is also correct. This is also correct if time is not mentioned. Both are correct. And you can think any way possible, no problem. But if you say time, then rule changes. You put yesterday, this is right. If you put this week, then this is gone. It should be has undergone. Okay, fine. Write down one sentence for this one. Write down one sentence for this one. Next. All of you, those who are active, they will get quality. Those who are not active, that's not my problem. Next one. Sentence structure 3. Mr. Baker was recommenced on 100 mg aspirin daily post-operatively. Instead of recommenced, you can say commenced, prescribed, or advised, or recommended, or suggested. Write down all these words. So you can use somewhere else. Mr. Baker was commenced on. Mr. Baker was prescribed. When you say prescribed, no need on. When you say commenced, it should be on. When you say prescribed, directly you can write recommended, advised, suggested, prescribed, instituted, all these different types of sentences. Post-operatively, one word. Post-operatively is one word. That is how it should be. Write down one sentence like this. Don't stop. Once you stop, that means you accept a defeat. Right or wrong, whatever you want, write something. Don't accept defeat. Instead of aspirin, you can say some other thing. Instead of 100 mg, you can say 1 kg also, no problem. Huh? In between, there should be some fun also. Mr. Baker, very good. Yeah. Following his, also you can say, after his, post-operatively. Yeah, anywhere different types you can write. Try to use them. Right. Next question, next sentence. Sentence structure 4. This is called guided learning. Many people don't know. This is called guided learning. Now I'll show you. I'm teaching, I'm using a method. I'm using a style. I'm using a different approach here. Now let me show you. Yeah. Now what is this? Guided reading. Guided reading. Now what is this guided reading? Guided reading. Guided reading means is an instructional practice or approach where teachers support a small group of students to read a text independently. So guided writing also in the same way. Small text, bit by bit. Guided writing. Guided writing is a small group approach involving the teacher meeting with a group of students with similar writing needs. It can be thought of as a group conference or a small group mini lesson undertaken strategically in response to an identified challenge faced by the selected student. That means you are facing writing sentences, grammar. So those only we are following. So that is what is called guided writing. So that's what we are doing. I'm giving one sentence, you are learning the other sentences. You are trying to parrot, or you are trying to imitate or learn using the similar style. Just changing the words, you will automatically, the style goes into your brain and gets fixed. Right. Number 4. In addition to his usual treatment for hypertension, he requires a pain relief. Panadine Forte, max 8 tablets per day, and daily dressing changes to preserve his skin integrity. I'm giving you a bigger sentence now. In addition to his usual treatment for hypertension, here comma will be there. Yes, go through this one now. In addition to his usual treatment for hypertension, he requires this also. That is taking already treatment. This also is needed. In addition, in addition, you will write a sentence. Try to make your own sentence using this style, all of you. Those who want to improve, write. In addition to his usual treatment for hypertension, in addition to his usual treatment for diabetes mellitus, he requires medication for hypertension and diabetes diet for maintaining his blood sugar levels, something like that. Daily dressing was initiated. Very good. Very good. Very good. Reshma Raju, an extra walker. An extra walker. That means already walker is there and another extra walker he needs. I don't. A walker is enough. Why do extra walker? I don't think extra is needed. Extra walker means already you have one and you need another one. Then you say an extra walker. Otherwise, extra is not needed. Okay. So learn sentences, how you have to write sentences. Write mistakes, no problem. Write mistakes, at least 50%, 25% will go into your mind. Write mistakes, no worry. At least you'll get ideas. Start writing. This is correct sentence. Based on this sentence, you try at least 25% correct things you'll get. If you don't get, no problem. You will know how Panadol should be written. You will know how Ford should be written. Okay. How would pain relief, that thing is, pain relief is the name, that is Panadol Ford. That's put in brackets. Like that, you can write everything. Next. He has good mobility and can walk along the ward using a wheelie walker without difficulty. He has good mobility. Mobility is uncountable. So A should not be written. Write down mobility, no A. No A. Never write A with mobility. He has good mobility. Now instead of good, you can say excellent. So improve the quality. Instead of good, write excellent. So this is an active voice sentence. You can change into passive voice also. Good, excellent mobility has been noticed. Excellent mobility. Okay. Mobilization is possible with the support of a wheelie walker. Okay. Ambulating independently without any external support is possible with the help of a wheelie walker. Excellent mobility has been noticed. And walking along the ward with the support of a wheelie walker without any difficulty was reported. It should come like that one. There are two sentences in this, joined with and. Ambulation is possible with the support of a wheelie walker. Walking independently along the ward of the hospital with the aid of a wheelie walker without any difficulty has been observed or was noticed or is noticed or has been observed. Excellent mobility is noticed as is observed in walking along the ward with a wheelie walker without any difficulty. Covering the length of the ward with a wheelie walker is possible. Using a wheelie walker is possible. With the assistance of a wheelie walker, with the assistance of a wheelie walker, with the support of a wheelie walker, walking along the ward is possible. Write down your sentences. This is the easiest method of learning. That's why I'm giving you this one. Otherwise, you'll break your heads also. It will be difficult. When you see the correct thing and you repeat after that one, it is easy to learn like small children. Twinkle, twinkle, little stars. Twinkle, twinkle, little stars. How I wonder what you are, how I want. Repeat after the teacher, after the audio. It is easy to learn because that's a style. That is called guided reading. Guided writing here. We are giving one example. You will follow that example. Though you cannot get 100% accuracy, you can get at least 10% accuracy step by step. After 10 times, you'll get 100% accuracy without doubt. With the use of a wheelie walker, hyphen, A.V. Magesh. A walker. walker, 1 walker, 2 walkers, 3 walkers. So A is must. However, comma should be immediately Bushra. It should not be after space. There is no space before comma. He can also walk independently along the wall. Avoid he as far as possible. That is not fine. Do not use he is a ordinary English, school boys English. So avoid that one. You're a doctor and definitely you can change the style. Mobilization is possible, you can say. Okay. Mobilization is possible. We know that it is he. Next. Oh. Very good, very good, very good. Anne, Abby, very good, wonderful. Everyone is doing something. Okay. I can notice the students were really serious. So tomorrow, those students who are writing these things, if you have any doubts, I'll give you a chance to discuss. No problem. Okay. Fine, wonderful, wonderful. So yesterday one girl was asking, I don't want to take the name because I do not have the permission. So when do you sleep? When do you sleep? This is night time. When do you sleep? I was surprised. Somebody is concerned. Sir, you're struggling too much. Take some rest. That's what they were saying. Okay? Fine. So I'm there for you always. That is what I meant to say here. People are realizing that Simon sir, when Simon sir sleeps, they're noticing. And when Simon sir doesn't attend for 8 hours, there will be a hue of cry. People will say, somebody go and find Simon sir. Where is he? Like that one. So that is the problem. So learn these sentences. Very good. Very good. Nidhi. Excellent mobility has been observed. And he can ambulation. So excellent mobility has been observed. You have written wonderful sentence, Nidhi. Then why did you write again he? And ambulation without any support. Excellent mobility and ambulation without any support have been observed. Together you mix up. That's it. Then with the use of a wheelie walker, Abhi Magesh, a wheelie walker, his mobility has increased. His remove. Mobility has increased. Why his? Who wants this? Yeah. He can ambulate with the use of a wheelie walker. Spelling mistake and full mobility has been noticed. Okay, remove he, all. Very good, very good. So next sentence. 6th one. He is to undergo a series of range of motion, stretching and strengthening exercises, and occupational therapy to ensure a full recovery. He is to undergo a series of range of motion should be hyphenated. Whenever you are writing range of motion, you have to write like this only. Range of motion. He is to undergo a series of range of motion, comma, stretching and strengthening exercises, comma, and occupational therapy to ensure a full recovery. Write down your own sentence based on this one. So instead of he is to undergo, you can make it passive voice. Remove he is. Don't want this nonsense. undergoing a series of range of motion, stretching and strengthening exercises, and occupation therapy to ensure a full recovery is required. Finished. Remove he is and put is required or are required. Finished. So simple as that. People don't know. If you remove he, the doer of the action, and undergoing a series, that is important. So you make it the king of the sentence. Undergoing is required. Finished. So simple as that. People don't realize what to do. That is not our problem. Those who, that is their fate. If they don't want to realize, let them face their difficulty. Lifestyle modification is required. I'll go for job and I'll also study. I want money, but I want success. No way. No way. No way. Full-time dedication is needed. Otherwise, you lose the chances. Right. He is to undergo a series of range of motion, stretching and strengthening exercises, and occupational therapy to ensure a full recovery. Supervision of medication compliance, regular monitoring of medication compliance, regular monitoring of medication compliance. A, dietary consumption, diabetes diet, regular supervision. He is to be supervised for, like this one, he is removed. Regular monitoring of medication compliance, diabetes diet, and exercise regimen is required. Finished. Finished. Regular monitoring of medication compliance, diabetes diet, and exercise regimen is recommended. Finished. Don't want he, she. Directly start. Give the blow on the forehead. Okay. The enemy should drop down dead. If you want to win OET, you have to give what it wants. It's a preordained game. If you shoot at the right time, that you are going to be a winner. Wrong time, and even before the enemy attacks, that means you are the loser. There is no other option. It is fate decided already. So you have to hit at the right time. Otherwise, fail. No chances to escape. Next one. Very good. Those students who are participating in the activity definitely will come out with flying colors. Flying colors. No questions asked, no answers provided. That's it. You are learning for your own benefit. I'm telling you to do something. Okay. Undivided attention. Why should I do all these things? You will never know why should. Simon sir is not mad to give all these things. He's already trained. He has international certification. He's double masters. He's a teacher trainer. He has 33 years of experience. He's telling you for your own good. because he loves you. He considers you as his people because you bring name and fame for him, which is more important than the money you pay. And it's not for the wisdom you are paying. You are paying for my services. Wisdom is free. I'm only paying for my services because I'm sitting with you and explaining all these things to make it simpler for you. That's service. Knowledge is there anywhere you can learn. Even without me, you can learn. I'm not everything here. People learn on their own all the things. So next one. Six, seven. We are sending a walker and a veg pillow with the patient. Our social worker has organized hire of a toilet raiser for 2 weeks. Now this sentence can be joined. Why should we say we? It is only giving this example. But it is always telling you don't use the person who is doing this. A walker and a veg pillow are provided. Whereas a toilet raiser has been hired for a fortnight. Finished. So simple. These two sentences are joined into one sentence. This is B grade sentence. Yeah, you will get, if you write as it is, you will get B grade. Again, you do mistakes in this, you will get C grade. Those people got B grade because at least they are writing them correctly. What all little they learned, they are writing 100% correctly. So at least they are getting B grade. But many people are suffering. They are not getting B grade. Why? Because after learning all these things, still they are doing mistakes. If you students are seeing some students, then my life has become white here. 33 years I am seeing students and their progress. You have data of 4 or 5 students or 100 students. Even before you were born, I started teaching. Okay? So that is very important here. So try to understand. We tell you because of our experience. So here active voice don't use. I told you this case notes is taken from official OET. It is giving ordinary things. Why they are giving ordinary things? Because you people cannot understand if it is given in difficult level. If what style I am telling you, if you don't understand and that is given in the OET paper, then you will not. You will run away from OET only. Oh, this English is very difficult. So that's why they are simplifying and giving at least to learn this one. And if clever people automatically get even more than that. So here remove we, remove our. What is important? Willy Walker is important, veg pillow is important. Who is sending Walker? This is not important. You will send Walker with the patient only, with not the doctor, with not the nurse. It is understood and only one patient is there. That is Gerald Baker. Why should we write again with the patient and never use the word patient? Because it is derogatory. It is insulting. You go, you take your parent or brother or sister or mother or father or somebody else with you to the hospital and you admit him there and a nurse comes there or a doctor comes there. And what about this patient? Why this patient is here? You'll get angry. You'll like to slap him. Useless fellow, how dare you tell my brother as a patient? He has a name, ask him. Otherwise, ask me. How dare you call my brother as a patient? Nobody has right to call any patient as patient. because it's insulting. They feel offended. They deserve respect. It's not like a famous name like doctor. Doctor means you can feel proud of. Nurse means you can feel proud of. But patient means people get offended. Okay, I'm sick, I know that one, but how dare you call me patient? You are giving me a label that I'm patient? Useless fellow. They will think like that. They'll come and slap you also if you talk in front of them directly. They will not spare you. So never use the word patient. By mistake, if you use like that really in front of patient, you'll be talking like that and they'll be offended and they'll complain about you. If people like somebody, serious person is there, they'll thrash you there itself. How dare you call my father as a patient? Who gave you the right to call? So indirectly, I'm telling you a lot of things. A walker, a wheelie walker, and a wedge pillow have been provided, whereas a toilet razor, has been procured or organized for a fortnight. Simple thing. That is A grade sentence. Why you cannot get A grade? Because you don't want to get A grade. You want to just pass OET. Just pass OET. Hanging gardens, you want to hang it, that one. And that hanging gardens break and you'll fall down into the deep gorge. Fall down deep. Where you cannot come up. You cannot be retrieved from there. That fall, that deep you will have a fall. Okay. We are remove. A wheelie walker and a wedge pillow have been provided, whereas or but a toilet razor has been organized for a fortnight. Finished. One sentence, quality sentence, without we, without our. 7 sentences I have given you. Yes. How many of you believe that these learning this way is useful? Yes or no? Anyhow, you cannot create a new sentence. So what you do not know how to go to the market. So at least somebody is going to the market, go along with them now. Go along with them. At least you will reach safely. You will not go to other place. You will go to this market. Because the other person is going to the market, you are going along with him. Finished. Why playing the fool? At least learn these things. Okay. Right. Next sentence. 008. Yes, next. Next part. Yes. During post-operative recovery, Mr. Baker appeared disoriented. During post-operative recovery, comma, during post-operative recovery, Mr. Baker appeared disoriented. Appeared, seemed, looked. Post-operative, one word. Yes, I'm giving a quick high five for you all. Just get here. Stop everyone, whatever you are doing. Just listen to me. I'm going to give you a quick fix. Okay? Because I don't have time. So you need first feedback. Okay. Fine. This is what it is. Review. Stop everyone. I'm just giving 15 minutes. And after at the end of 15 minutes, okay, I'm going to stop. So it's the first track. 20 pages are here, but it will not be even 20 minutes. 15 minutes are sufficient for this. Go through this, what I am doing. Yeah. Mr. Woods has hand left. No, this is something wrong. Okay. So yeah, discontinued. Okay, maybe unnecessarily it was pushed. Mr. Gerald Baker is recovering from left total hip replacement surgery. Is recovering means now. It is a continuous process which happens for a prolonged period, not just now. I am watching you now. I am teaching now. This is happening now. But when you are doing for a long period of time, you know that, and not just recovering. Recovering now means at this moment. Simple present tense. So present continuous tense should be there. So it is was recovering, and is recovering and will also recover. That means from past to future, it is continuous. So then you have to say simple present perfect continuous tense. Mr. Gerald Baker has been recovering. This is correct only. Is recovering is also correct only. But it will be at the moment. But topic wise, recovering will not happen just this moment. It will be from the past till now and from now till the future. Recovery is a continuous process until total recovery is done. So it should be has been recovering from left total hip replacement surgery. No A. Very good. That's correct. Punita Frankina. Don't do anything else now. Stop everything. Stop everything. I don't want anybody to write anything. That's the end in itself. The end of the session. Just hold on. The end of writing. No more writing. Not even one sentence, not even one word. So it will be distracting everyone because they have to focus here. Don't write anything. Sir, I have written already half. So that is your problem, not ours. Okay, when end is, bell is done. So when Gerald Baker, Mr. Gerald Baker has been recovering from left total hip replacement surgery. Yes. Mr. Woods had left total hip replacement on 5 December 2016. Yeah. So 5 December, you can say date as just 5. That is better. Okay. Mr. Woods had left total hip replacement on 5 December 2016. Whenever you have this one, your sentence you write. Whenever you have a sentence, you just write full stop there. Write full stop there. Mr. Woods had left total hip replacement on 5 June December. So whenever this on 5th December, this date is there, whenever you have date like this, you can take it forward and put it here and put a comma. Always date is there, you pull forward. On 5th December 2016, Mr. Woods had left total hip replacement. That's it. This is how you have to write. The next one. So I'm giving you chance to unmute. So when I tell and take the name, that time you can unmute, and I finish yours and take the second person's name. Automatically you have to mute back. Okay. Automatically you have to mute back. So Shehla. I'm giving a chance for everyone to unmute. Yeah. Shehla, unmute. Punita, unmute.
Yes, sir.
Is that clear, Punita?
Yes, sir. Yes, sir.
Has been, you understand why has been? Because it is a prolonged process, not momentary process. I am teaching now. And I'm talking only about now, I have to say like that. But you cannot talk about only about now because recovering. It is a continuous process. So has been recovering, you have to say. That's the rule. Clear?
Yes, sir. Yes, sir.
Shehla. Are you there, Shehla? Are you left? Or S. Okay, Shehla is not there. So, fine. Bincy Robin. When I take the name, you can unmute. Mr. Gerald Baker underwent left total hip replacement. Wrong. It should be A left total hip replacement. That is what I was telling you. When you use replacement, you have to use A.
Okay, sir.
Mr. Gerald Baker underwent A left total hip replacement. A
Fine,
is
sir.
important, but when you use surgery, no A. But when replacement is there, A is a must. Learn the rules. Is that clear?
Okay, sir.
Then
Yes, sir.
Nidhi. Nidhi.
Yes, sir.
Nidhi. Yeah, Nidhi, are you there? Yes, Mr. Jem underwent THR. What is THR?
RTHR.
What
Total
do you
hip
mean
replacement.
THR? So,
Total hip replacement.
what is
Sorry.
the spelling of total?
TOTAL.
Nidhi is very tired, so I will help Nidhi to write full. Okay? Huh? New student
But-
and Nidhi is tired now because I know it's already, what is the time now? 1 o'clock or 1:30 or 2 for you there in New Zealand?
2:30.
2:30, no problem. Get up late. Get up
That's
late.
fine. No problem.
Total hip replacement. You're a very good student. You're ready to accept something is told. Okay, Mr. Jem underwent total hip replacement.
Total.
Total hip replacement.
I have a query.
Yes,
There was one more sentence with had total hip replacement. So we don't need to write before total.
compulsory you have to write if
Because there
replacement
was-
is there, but if surgery is there, no need
No, because you didn't correct in the last sentence before Bincy.
where
Yeah, here.
before
After,
Vinci. Mr.
on 5th
Woods
December.
had left total replacement.
Why
Is
not
needed.
A?
Yes, you are right.
Oh,
Is needed.
yeah.
Okay, sometimes we may miss some here and there. Na?
Okay.
Right?
I thought after.
No, it's wrong is wrong. Wrong is wrong.
Okay,
Once I
no.
told, always I need not correct. Automatically it is implied. Okay?
Yeah.
If I did not correct, that means I am wrong. That's clear. Because sometimes, when we are going fast, we may miss some things. Even I am a
Yeah.
human being, right? But if I tell A is a must, that means A is a must. Is that clear?
Yeah, because I thought it's a passive. That's why you didn't use
No.
the A.
Past tense or present tense or whatever it is. This A
Okay.
is not related to had or tense.
Okay.
It is related to replacement. When replacement is
Count and-
A is first. Tense, devoid any tense. Tense is not at all bothered here.
Mhm.
Replacement is noun, so A is needed because it is countable noun.
Yeah.
So uncountable noun is surgery, so no A, that's all. Countable noun, no countable noun, a replacement. Uncountable noun, just surgery without A. Is that clear? Okay, fine. Right, you are right, absolutely right. I missed that one, but I have already told many times. So even if I miss, it is understood. Is that clear?
Yes, please.
Then next, what is this A shortest tense sentence? Okay, fine. Mr. Baker, who has been recuperating from left total hip replacement surgery. This is incomplete sentence. Then you need not write who. If you write who, then automatically you have to put a comma here. And you have to put another comma here. Mr. Baker, who has been recuperating from left total hip replacement surgery, requires something else. So you are joining two sentences with who. There is no second sentence. So how can you write who? Remove who. That's it. And put a full stop here. Next. Mr. Baker has been recuperating from left to total hip replacement surgery. Surgery is there, so no need A. Next, Mr. Gerald Baker. Anne. Anne is there? Yes, Anne, very good. Mr. Gerald Baker has undergone a left to total hip replacement. And in the end, full stop is needed.
Okay, sir.
Okay, Mr. Gerald Baker has undergone a left total hip replacement. Next one, Mr. Bunn. Mr. Bunn. Mr. Bunn, who has been recuperating from left total hip replacement surgery. Who is this again? Is this the same guy, Manikanta? So who? When you say, you cannot say who when you are not adding another sentence. Mr. Bunn has been recuperating from left to total hip replacement surgery. You are not adding another sentence, so you cannot write who. Otherwise, you can add like this: Mr. Bunn, comma, who has been recuperating from left total hip replacement surgery, comma, requires regular supervision and appropriate management following his discharge today. Like the continuation is there, then you have to write who. Otherwise, you are not supposed to write who there. Next one. On 4 September 2018, this is date. So put a comma. He underwent left total hip replacement. Or you can say here, underwent. Instead of underwent, you can say left total hip replacement surgery was performed. Like that also you can say passive voice. He underwent left total hip replacement surgery. Very good. Anila, excellent. Manpreet Kaur. Mr. Gerald Baker. Remove who? Has been recuperating from left total hip replacement surgery. Full stop. Compulsory. How can you write a sentence without a full stop? Where will the bus stop without a bus stop? Mr. Gerald Baker underwent a left total hip replacement on 4 September 2018. Nimmi. Which Nimmi? Nimmi from Muscat? Nimmi George Kuti. Nimmi George Kuti. Okay. So, I don't think this is that Nimmi. Double M-I, that one. Okay. On 4 September, whenever you have time, push this one to forward. On 4 September 2018, comma, O capital letter. On 4 September 2018, Mr. Gerald Baker underwent a left total hip replacement. Full stop. Finished. Nimi, is that clear? I don't know whether Nimi is there or not. Not there. These people will come for just a time pass. Okay. I don't want to stay till the end also. Mr. Gerald Baker underwent left total hip replacement on 4 September 2014. No need to write all these things. When you write 4th, then you have to write the 4th of September. Arati Ashok. Arati Ashok. So this on 4 September 2014, you take it forward and put a comma here. Because what is in the end, you brought it forward. So you separate it with a comma and write a capital letter there. Arati Ashok, are you there? Otherwise, why I should correct? I am mad. Simply correcting all these people's answers. Let me see here and correct. Why should I waste my time? Okay. Such people, why if they come, I don't understand. This is the reason why I don't give to newcomers. I give the chance, they don't even learn. Okay, no problem. What is our problem? We are not the losers. Okay. Now coming from here. Yes. I watched, do we don't want disorder sentences? Sorry. I attended no, this also we don't need. We want subject sentences. Yeah. So Mr. Jem underwent total hip replacement surgery. Mr. Jim underwent total hip replacement surgery. Very good. Mr. Robert presented with severe cough and sneezing yesterday. So Mr. Robert presented with severe cough and sneezing yesterday. Where is the full stop? And yesterday is time. So take it forward and put a comma. It doesn't mean that it is wrong, but this gives more impression. Excellent impression. Yesterday, Mr. Robert presented with severe cough and sneezing. Okay. The next one. Mr. Blith had a fall at her home yesterday. Whenever you have these dates, for better impact, take it forward. Okay. What you have written, Bincy Robin? You are a professor. Mr. and her, what do you are
Mr.
making?
Blith had a
gender
fall
nonsense?
at his home. That was Miss Blith, sir. That's why.
Which was
By
misplaced?
mistake, typing mistake. It was
I
missplit,
don't want
had a
to, I
fall
don't
letter.
want any excuses. I don't want any excuse. Mistake is mistake, finished is finished. Correct, leave it, forget about it. But here, when you are saying Mr. and you cannot
should be
type
his.
her, that's it. It came in front of me. That's enough. That mistake is yours. You have to keep on your responsibility. That's all. Okay, take the responsibility. No problem. It's no problem. We are learning. Mistake is mistake. Whatever it is, no problem. Shoulder the mistake. I do many mistakes. I say I accept. I apologize for mistakes. So just now you have seen I made a mistake. Of course, it was in my speed. I did not notice. And that girl Nidhi was asking me. She was appropriate. She was 100% right. She helped me. But mistake was a mistake. I told I just was rushing and I did not. But excuse will not help. So I had to go there and correct. So I thanked her. Finished. So that's it. We are learning some things. Even I do mistakes. Everyone does mistakes. So learning from mistakes is good hobby. So instead of giving excuse, let us shoulder the responsibility of the mistakes and let us try not to do those mistakes once again. Okay, Binsi? Hello?
Hello, definitely, sir. Next time it will
Don't
not
get
be
upset and don't get angry. I am your teacher, okay? If your parents,
Yes,
your
sir.
mama and papa shout at you, you will not get angry. You will go and cry and come back and say, sorry, mama. Okay?
Sir,
No
definitely.
problem. You are making a Mr. into Mrs. What to do? Okay, whatever it is, that's it. Now I am in front of you, you are explaining. But what will others think, those who don't know? They're not in front of you. The same thing in the internet. Tomorrow they will see. And they'll say, who is this person? Oh, Binsi Robin. Binsi Robin has changed the gender. What happened? Mr. and her. What does she think? She doesn't know. That is what they think. Okay. Right.
Yes, sir.
So his. No problem. Okay. Yesterday, Mr. Blith had a fall at his home. Right. Mr. Baker was admitted on 16 February. So take this forward. This is called the setting, time setting. On 16th February 2019, Mr. Baker was admitted. Right. He was recommended with physiotherapy. Physiotherapy was recommended. Avoid he. So simple as that one. Physiotherapy was recommended. Full stop. Right. Physiotherapy was recommended. Is that clear, Somi? Somi is not there. Why I corrected this paper? Waste of time. Mr. Smitha was initiated with physiotherapy. Smitha is there. Okay. Ashley is there. Ashley is not there. Leave it. The next one. Mr. Jim presented with shortness of breath. Very good. He has been initiated with physiotherapy. Physiotherapy has been initiated. Just Somi Anil, we don't want. She is not there. Okay. So, Ashley, candidate, or you can say not present. People will think again what Simon sir doesn't know, that's why he did not correct. Bad people tell anything they want. Okay. Next one, Somi Anil not present. Okay. Punita. Punita is there? Yes, she is there. Okay. Whenever I call your name, open mic. Mr. David was admitted with the complaints of headache and fever. Who will put a full stop? Punita.
Okay, sir.
Right. Mr. Robert presented with severe cough and flu. Mr. Smith was diagnosed with depression. Mr. Smith was diagnosed with depression. Mr. Gerald visited. Mr. Gerald is wrong. Mr. Baker, you say. Second name is important. So, Baker. Mr. Baker visited visited the emergency room. with the complaints of abdominal pain last week. So this last week will go forward. Last week, Mr. Gerard Baker visited the emergency room with the complaints of abdominal pain. Very good. Nidhi, Mr. Smith first visited with a history of fall. If it is a history of fall, he need not tell. You can first visited following a fall, you can see. Initially, Mr. Smith initially visited with a history of a fall, not with a history of a fall. Following a fall, you can say.
Yeah.
The history of a fall will not come. Right, Mr. Smith first visited.
Okay.
With the complaint of something I could have,
Yeah,
right?
that you can say. That you can say. Okay.
Yeah.
History means past, and that is not suitable here. Okay.
Yeah.
Medicine medical.
Mr. Smith first visited.
അതിന്റെ മെഡിസിൻ ആണോ അത് എടുക്കുന്ന
Okay. Right. Mr. Smith initially visited following a fall from the staircase. Mr. Smith initially visited the hospital following a fall or after a fall from the staircase. Is that clear?
Yeah.
Huh?
Yes, yes.
First
History,
visited
where
after
can
a
we
fall.
use?
Huh?
Where can we use history, like a history of
He has a history of
hypertension?
he has a
right?
history of present tense. He has a history of he has a family history of diabetes. That means his mother or father has family history. That's why he has a history. Means past. No need again had.
Okay.
Okay, like that you can use. He
Okay.
has a history of cardiovascular accident. Like that one.
Okay, yeah.
Like that you can use. Physiotherapy was initiated. Ashley is there? No. So candidate not present. Okay, medications were given in hospital. Medication. Bhavana is there? No. Next. Manikanta is there? These people, they think that they know everything. Huh? Okay, no problem. See mistakes. Mr. Baker was diagnosed with pneumonia and treated with antibiotics prior to discharge last week. So last week should go forward. Okay, not present. Mr. Baker has been discharged from the city hospital back into your care. Has been discharged means finished? No, is being discharged. Now has been means finished. Now it is happening while discharging. Already discharged, then why you will write a letter? So he is being discharged from the city hospital back into your care. No need, comma. Okay. Right. Mr. Baker is being discharged from the city hospital back into your care. Okay. So like this. So fine. Okay. So hope you understood. I thought I'll take some more, but a little long time I sat afternoon. So I need a break. So let us go. Final shot. What is that? What is that? Yeah. Yes. Now, yeah, your discussion, your feedback. You write 1 or 2 sentences, what you learned and what problems you are facing. What you learned, what was the new thing you learned, and how was the session, what you learned, how was the session, and what you require. 3 things. What you learned new, any one thing you have learned new, that one you write. And you can write how the session benefited you, 1 sentence. And what you need in the future, 1 sentence, your requirements. Write down so that I'll make a list of those things and go ahead with the next week. Okay, fine. Now coming to the point, let's start beginning from A onwards. Yeah, Nidhi is open. Yeah, Nidhi,
Yes, please.
share your experience, dear.
As it was my first class, and though I have already given the exam like last year, but I almost forgot everything. So today I learned lots of new things, like different kind of sentences. Like I have never seen, like we can make from one sentence we can create lots of, a variety of sentence. So this is the new thing I have learned today. And also a bit of grammar. And before I used to learn the lines, because last time I gave an exam, I learned the lines, like where I can use a, so this is a new thing also. I learned a total hip replacement and no vowel with surgery. So I know this is countable and non-countable, but sometime, before we never put in place these kind of things when we write. So yeah, it was overall a good session.
Fine, thank you very much. Okay, other students, just write 1 or 2 sentences, what you learned and other things. Okay, next one. Anne.
Hello.
Yes, Anne, share your experience.
Hello.
Yes, please, share your
Yes,
experience.
sir. Yeah. Before also, I didn't notice the uncountable and countable noun. And when you explained, I know the importance of the to add the a before the replacement. So it's very helpful, sir. Reads many things I learned from you.
Okay.
Importance
Next.
of tense,
Okay, fine. Thank you very much. Bincy Robin.
Thank.
Bincy
Hello.
Robin.
Yes, sir. Good evening, sir.
Good evening, dear. Yeah, can you share anything? What happened yesterday? I saw your message. I am out. Please give me. Did you come back into the room or not?
Yes, sir. There was some like network issue, and I was out and like was waiting actually. And because of the class, you were not able to see my message also.
Sorry for that.
No,
Okay.
sir. I'm sorry.
No problem. No problem. Okay. What did you learn today? New things, and what are your experiences?
Yes, sir. There were
Let's
many
write
new
1 or
things
2
which I have
sentences,
learned
please.
definitely because they like the tense, the past tense, present tense, and how we can use actually in the in the writing. I learned because previously I was not all these things like before surgery and like replacement, like those things where a should be put, that I was not knowing actually.
Okay.
But it was a good experience, like how to improve it while writing and to score good marks.
Yeah. Next. Dr. Bushra.
Yes, sir. Yes, sir.
Dr. Bushra.
Yes,
Where
sir.
are you from? Islamabad or Lahore or
No,
Faisalabad?
no,
Which place?
I'm from Karachi.
Karachi. Okay. What is special in Karachi?
Now it is known as the city of light, but nowadays it's always a load shedding. So, but we have a beautiful seashore, and we have a
Yes.
beautiful, yeah. So, and the hospitality of the people are are always highlighted. So we, so
Okay, so when I come to Karachi, you will give a lot of hospitality to us.
yes, definitely,
All the
sure,
students
please,
I'll bring to your house, okay?
sure, definitely, sir,
From all
definitely.
over the world, they will come. Okay, right. Now share your experience, dear.
Sir, actually, it was a very informative session, and the thing I learned is I came back into practice of making a sentence now. But still, I'm still confused. I will also learn about more. If we are talking about near past things, for example, if we are talking about yesterday things, so we should use simple past tense. And if you are talking about far past thing, for example, a week ago, so we are using perfect past tense or past perfect tense. So anyhow, this comes with time, I guess, in practice, and it is indeed a very good session.
Fine. Thank you very much. Priya Thomas.
Sir, good evening, sir.
Good evening, Priya. How are you?
Fine, sir.
Okay,
Sir,
yes.
actually, this class was excellent, and you have explained the tenses, where to come and how to use, and how to make a sentence with these tenses. And this is very excellent, sir.
Thank you very much. Punita.
Thank you very much, sir. Your excellent explanation, sir. Clear many my doubts, sir, and importance of tenses and where and how I can apply now noun and verb and all. Today's class I cleared, sir. Thank you very much, sir.
Right. Anybody else? You have any requests also? You can tell me, sir. I have problem in this one. That also you can say. Ravi Sharma.
Hello, sir. Good evening, sir.
Good evening, Ravi Sharma. So you fought, you resigned, and you came back to me, no?
Yes, yes, sir.
Without resigning or without taking leave, you cannot study with me, correct?
Exactly, sir. So you have to spend the time with you, sir. Compulsory. It's needed.
See, I am struggling hard to give you excellent quality, and people say we don't have time. So who is the loser? I am the loser, or people are the losers?
Exactly.
Correct or not?
Exactly.
So now you are in full power. Any time, if I say midnight, you are ready. In morning, you are ready. And whenever I am going to sleep,
24 hours, I'm free, sir. Now there is no work for me. Just study and work. That's it. Yeah.
Excellent. Next. Next one is Srilata.
Good evening, sir.
Good evening, Srilata. Did you understand some points?
Sir, I'm very sorry. I have just come into the class maybe half hour ago. I will check back with your YouTube channel.
Morning session I did not put in the YouTube.
This
by
one,
mistake.
sir.
By mistake, I
morning
forgot.
session I attended.
Okay, no problem. This session
And I have sent 2 sentences for the sentence structure, but it wasn't seen. So I do not know whether it is correct or not.
Okay, no problem. I can check for you because you are the last one. Everyone has corrected number of sentences. So I'll correct it, no problem. So
thank you so much. I will be checking back with your channel, sir, so that I will.
No problem. Yeah. What's the name?
Uppula Srilata.
Srilata, where is your sentence? Control F. S. Where is it? Control F. SRI. Yeah. Srilata.
Sir.
In spite of 3 words, not 2 words. In separate, spite separate, of separate. Okay.
Okay.
Are you able to hear me?
Yeah, I can hear you.
In spite of his excellent ambulation, huh? Excellent ambulation is positive. He can still walk. Is also positive. So you can use not use in spite of. They have to be contrasting. Then only you can use in spite of.
Okay.
Okay.
So how do I?
You cannot use this sentence using in spite of. In spite of his weak ambulation, he can still walk. That you can say one negative and one positive. Then you can say in spite of. You understand?
Yes, sir.
This is excellent ambulation, positive. This is walk through the word, that is also positive. So you cannot use in spite of. In spite of his weakness, he can still walk. That is okay. Weakness is negative, walking is positive. Now you understand?
Yeah, I'm getting.
So you cannot write in spite of here. No way, no way.
Okay.
Okay, that is a wrong sentence. So you can correct it as like, okay. Ambulation is excellent. For example, he can walk through the ward utilizing a wheelie walker, wheelie-walker. At ease, right? You can say like that. Okay. Next. Okay, that's it.
There is one more item, sir.
One more. Okay.
To ensure a full recovery.
Yeah, I got it. To ensure a full recovery, comma, should be immediate. Not this far.
Okay.
Immediately. To ensure a full recovery, he needs to undergo a series of range of motion exercises, stretching and strengthening exercise, and occupational therapy. Like that you are right. And occupation, stretching and strengthening exercises, that also.
Okay.
Okay.
There's one more, sir. I think the last
Right.
one.
So anybody else is there? Ravi Sharma. Okay, everyone is done. Okay, then good night.
Thank you.
Bye-bye. Hello, Nidhi. Nidhi?
Yes, please.
Yeah, yours is the first day, right?
Yeah.
So don't worry. What you do is how the people are posting, how the people are taking the printouts and doing and how they are submitting. What are my instructions? Follow the instructions. Every day you have to do one reading, listening, writing and submit. You have to take the printouts. Don't do on the mobile or the laptop. Take the hard copy and do on them. Then afterwards take the PDF and send like how everyone is sending. Just follow. 1 day, 2 days, you will adjust everything. You will understand everything. You can follow it very easily. So don't worry. You can go ahead and practice like this. And tomorrow, I want you to submit. Okay, today is already late. So tomorrow get up late, no problem, permission granted. So tomorrow I will get up late. And then afterwards, do one reading, one listening and one writing. And submit. So morning, what you have to do is first time you have to send a timetable. Then afterwards, Okay, based on the timetable, you will be doing your test, your own time, whatever time you want, you can give, no problem. So
okay.
your timetable you have to do, and then you have to submit them. Then afterwards, you have to present your report in the evening. How many marks you got in reading or listening, you can correct and you can post it. And then writing, you have to post there so that I can get it corrected. Okay, I will correct them and I'll give them. And sometimes I'll call when you are improving. After some days, I'll tell you, I'll come call and improve. So like this
No.
correction I'll give, and individually I'll call on a WhatsApp video, and you can discuss with me. Like everyone is coming like that, either WhatsApp video or IMO or Zoom. Okay, live sessions one-on-one. So you and I will be discussing, and you will see, we'll have face-to-face interaction. Okay, anybody new? Yeah, Ravi Sharma also same. Ravi, I need not tell you again. Okay,
Reading and writing, just you will check, or do I need to check and send you the
reading
mark?
and listening you can check and you can give your marks.
Yeah. Okay, yeah, cool.
Okay, or you can ask somebody to do so that you can redo it afterwards. If you see the answers, you'll know the answers, so you cannot try it again. So
That's
if
okay.
somebody corrects, then you can erase the mistakes and try again, thinking in a different style. So that is
Okay.
how. But writing, you write and send it to me. Then afterwards you can type it and send it to me. 2 versions. First writing, handwritten, then you can type using artificial intelligence. Okay.
Okay.
So if you face any problem, no need to type everything. Just there will be a mic in the WhatsApp below the tab, and that mic, if you press, automatically Google will type it everything, and it will change it into text to speech. You know that, right?
Yeah.
And afterwards, if there are any mistakes, you can correct that one. That's all. Fine.
Yeah, sure.
Okay, so submit your listening scores, reading scores in the evening. Writing question, whatever you are written, you have to take the quality check printout, and you have to submit the quality check printout. Then afterwards, you have to type it and send it to me. And within 24 hours, your letter will be corrected. And speaking sessions, there are groups. I have given number of groups. You know that?
No.
1 to 10 groups I have given.
Okay.
Speaking groups, practice with Jisha, practice with Tara, practice with Sweeta. Number of groups are there. Okay.
Okay, yeah.
If you go there along with the materials, they are posted. Group links. Join in all the groups. How the speaking is going on, you see. Go and just practice with them. Raise your hand. The card will be put in every group. Raise your hand. Ravi, you also. Right? If you do not get the link, okay, you can just message in the group itself. Okay. So, not in that group. You can message me or in some other group where you are in. So you're in 25th October group. There you just put, some other will help you or I will help you, no problem. So you can just message there what you require. So you can join in all the groups and take 2 speaking sessions in each group. There are 10 groups. Okay, now also there is a group, 2 groups going on. One is practice with Anish, and second one is practice with Yadu. Krishnan has come back after exams. So he'll be taking, they are just interlocutors. They will only ask you questions because they are trained for asking questions. They are not English language specialists, so they will not give you anything. That is only for just practicing, rehearsal. Nobody will say excellent or nobody will correct you there. Just practice. Then afterwards, when you come to me, I will take one speaking and I'll correct your sessions. And I'll give you feedback, like how I give others. Okay? Okay, Ravi? Okay, good night, everyone. Bye-bye.
Bye.